Hi everyone, welcome back to the Chatty Vets podcast. I'm Brendan.
And I'm Charlotte. Thank you for tuning in. We're back again with our next bonus episode today. So we hope you enjoyed our 2-week takedown episode last week, celebrating all things veterinary nurses. We have a lot of incredible people that work in this profession, but given how busy we are, it's often difficult to take the time to reflect and celebrate some of our amazing colleagues. So we really hope you enjoyed the episode.
Absolutely. And thank you so much again to our 3 amazing guests last week too. Today we're changing it up. We're going back to one of our clinical deep dive episodes. No special guests though today, just us chatting your ears off.
Yeah, sorry about that, but hopefully you enjoy it. That's why you listen. But that being said, just you wait for the end of the month. We've got something very, very special in store, so keep your eyes peeled. In these bonus episodes, we aim to discuss some of the diseases and presentations you may commonly see in general practice, aiming to simplify the complex stuff and add new little helpful nuggets to your everyday bread and butter caseload.
So today we're starting off our new series of bonus episodes, which will scatter over the months to come with our series where we delve into all things endocrinopathy.
Yeah, looking forward to it. So today we're starting with skinny, starey-haired coat cats and chunky, lethargic dogs. Yes, you've got it. We're talking all things thyroid.
So before we get started, there's a couple of thank yous to a few of you who have reached out to us recently. Claire, final year vet student, who reached out to us on Facebook and said that she'd find some episodes covering common endocrine disorders useful. And that's what sparked this mini-series. So thank you, Claire. And we hope you find it useful.
Yeah, thank you very much. And also to Steph on Facebook, who spoke about struggling with all things diabetes. So don't worry, we've got you covered. We've got plenty of diabetes chats to come in the following months. But okay, let's dive in for today.
Okay, quick recap of the basics. Dogs and cats have 2 thyroid glands which sit either side of the trachea, slightly more ventrally than dorsally, just caudal to the larynx. And remember that there can sometimes be some sneaky ectopic thyroid tissue in the thorax, in theory anywhere from caudal to the larynx up to the diaphragm.
Yeah, and just as a really super quick recap, the main function of the thyroid gland to remember is to produce T4, otherwise known as thyroxine hormone, which is the only iodinated compound in the body. It's responsible for many metabolic processes in the body, including being anabolic, which means they can stimulate protein synthesis in conjunction with insulin and growth hormone. However, in certain situations, like in hyperthyroidism, they can become catabolic and promote gluconeogenesis and protein breakdown. But I like to think of it really simply as if the thyroid gland is working overtime, the metabolic rate is quicker, so animals lose weight, and vice versa for our chunky hypothyroid dogs.
And it might be an idea. In fact, let me start with the hypothalamic pituitary thyroid axis, which is that one where a few things use this, don't they? So the hypothalamus secretes the thyrotropin releasing hormone, TRH, which stimulates the pituitary, which then that releases TSH, which is thyroid stimulating hormone. And that hormone goes to the thyroid gland and stimulates T4 production, basically. And if I add a little bit there, I suppose, let me just quickly say, for our canine low thyroid, hypothyroid dogs, that's where we want the TSH and the T4 levels. And we'll go into that a little bit later down the line. But I'll add a little bit here that the T4 then gets converted into the active version, because the T4 is like the pro hormone, gets converted into T3 at the site of the tissue. And that's where it actually does the business end of what it does.
Yeah, exactly. So hopefully that wasn't too much physiology for you, but enough to sort of set the scene. But before we get into the clinical stuff too much, what actually is hyperthyroidism in cats?
Yes, it's basically like too much thyroid hormone, and it's rarely a cancer. I think 1 to 3% of cases are a malignant thyroid carcinoma. I think you get that kind of ones that just the thyroid gland just gets bigger and bigger, and the control gets harder and harder to achieve. I think that's the typical kind of way that I perceive it. But the vast majority, it's a thyroid adenoma or just this hyperplasia, and the cats just make too much T4.
Okay, so if we were going to dive into some clinical scenarios, let's set the scene a little bit. So what do you think a normal hyperthyroid cat usually looks like, Brendan? What would you say?
Okay, well, we'll start, but I think that it's hard to differentiate the enteropathic gut problem cat from the hyperthyroid cat. But they're the older cats, over 9, over 10, something like that. And obviously, your ears prick up when you hear, when normally actually you get them out and you go, oh, they're bony. You can feel it straight away, bony over their back. The owner might not have noticed it, interestingly, but the owners are always like, oh, no, he eats really well, or he's always eaten really well, or he's more vocal and trying to eat even more than ever. And I think in some ways they're a pain to live with. Some owners feel like they've got dementia because they don't know what the cat wants because the cat's
Mm.
meowing for this and that.
Yeah, absolutely. I mean, my alarm bells are going when it's a cat that's been losing weight, when it's been really hungry, if it's possibly been PUPD, so drinking a bit more than normal, if it's potentially behaviours change, so a bit more vocal than it ever used to be. If they come in and they say, oh, his coat's just a bit different, like she used to really, really look after herself, and now her coat's just a bit scary, not scary, a bit starey, or a bit greasy, or sometimes they just say a bit dull. They just don't seem quite right, is a lot of what owners might say.
Just going back to that a little bit, the time scale is quite relevant here because if they've been drinking lots for many months and there's not outrageous signs, diabetes is dropping off my list a little bit. Usually things are going to hit something fairly quickly if they're diabetic. And obviously it's the drinking a lot that's going to take you to diabetes. The thyroid cats will drink a little bit more, it's true, but the diabetics are super thirsty. Now, and obviously just think you've got concurrent kidneys going on there as well, which might make them drink more. So in terms of the exam, I do check for a goiter, a little slip, just run my thumb and finger down their neck just gently, lifting their head up a little bit while I do it, and you just feel that little slip, it flicks just under your thumb or finger. I've heard people say about 8 out of 10 of them have a palpable thyroid goiter, and I've definitely had the odd one which has got a goiter, a little goiter, and is normal as well. So they don't have to be active. Heart murmur is obviously common. Faster heart is common. How about you?
Yeah, I mean, honestly, I have to say, I don't know whether I'm just really rubbish at feeling them. I can't say I've ever appreciated a palpable goiter, but I don't know whether I'm just rubbish at feeling them because but and
Yes, you must
I
be
also,
rubbish at feeling. They're all
yeah,
they're all over the place.
well, I don't know. I just feel like I'm not that easy. I don't find them that easy. I mean, but then maybe I'm just not focusing my exam there because I feel like I already kind of know that it's hypothyroid before I'm taking bloods because
But
of the rest of my clinical
how are you
exam.
how are you doing it then? What are you doing when you feel for it?
Well, I'm just feeling around the trachea and feeling down the neck, but I just don't feel
Are you
like I can
lifting
ever
their head
appreciate
up?
them. Yeah. I just
You're
don't feel
lifting
like
their
I
head
can
up,
feel them. Yeah.
and then you're stretching their neck out a little bit, like lifting
Yeah.
their head up and lifting their chin up,
Yeah.
yeah, and then you're running your finger and thumb either side of their trachea,
Yeah.
and you don't get a little thing that pings just under your thumb or finger.
No, not that I've ever appreciated, but then I don't know whether I'm just rubbish at feeling them.
I
Maybe, I
think
don't
you
know.
should. Do you know what's happened? I think you've been unlucky and not had one for a while, and then you've kind of gone, "Oh, that's a rubbish test." Maybe because
Maybe,
they're
maybe.
definitely there. Yeah, keep
Yeah,
doing
but I
it. You'll
think
get loads.
yeah, but I think the thing is it's not the thing that makes me check for hypothyroidism anyway. Like, I'm not
Yeah,
going,
good
"Oh, I
point.
can't feel a goiter, so I'm not checking." So,
Yeah,
for
yeah,
me,
that's true.
if it's lost weight, it's got a staring hair coat, it's tachycardic potentially, maybe it's got a gallop sound, all of that sort of stuff is what's gonna direct me towards it's probably hyperthyroid.
I would say though, when you've got the really chunky one, I will sometimes think they're the ones that are going to be harder to control. And they're the ones that sometimes need a higher dose every 6 to 12 months.
Mm,
So I think there's a
yeah,
slight
maybe.
differentiation there.
That sort of leads us on to saying, okay, so if you've got a cat that's losing weight, staring hair coat, hungry, PUPD, we know that hyperthyroidism is on our list, but there's also a hell of a lot of other things that are on our list that we want to rule out, right? And I think we do sort of have a bit of a general older cat, these sort of similar symptoms, blood test that we would potentially be wanting to do. So, I mean, what are the other things that we'd be wanting to rule out or check that they don't have concurrently?
Yeah, such a good. Okay, I like the way you phrase that. So eating lots and losing weight is essentially overactive thyroid, diabetes, or enteropathy, gut disease.
Hmm.
I think it's got to be one of those three. Now, you can have concurrent problems going on, and that's kind of what you're kind of indicating, which obviously kidney disease is one of them. Hypertension is another thing you want to look out for. Certainly, you might want to have urine related issues like urinary tract infection on your list, and you might need additional things in the urine. If you've got some low level renal disease, you might want to be thinking about UPC as well. So they're the kind of things. In terms of bowel disease, hardest one to diagnose in some ways. My two non-invasive kind of tests for that are B12 and folate blood test. And I don't know, rightly or wrongly, I noticed the ranges on the labs. I'll get quite a few cats in the just above the lower end of the range for B12, but I will tend to think of that as suspicious for gut disease as well. And then ultrasound, if I've got a willing owner and everything else has come out normal and the
Mm.
cat's losing weight, I'll say to them, well, cat can't keep losing weight like this. We've got to do something. And I say non-invasive, nice test. And a few of these cats will have a thickened bowel wall or a thickened muscularis layer to their bowel wall, which is easy to identify once you get the hang of it. And
I'd say agree with all the above. The only things I would say is that I have occasionally seen the cat with CKD that is more hungry, not less hungry. Occasionally. It doesn't happen very often, but I would
it's
say
because it's got
just
bowel
because
disease.
yeah, probably. And it's probably because there is something concurrent going on. But I would say don't completely rule out renal disease just because they're not inappetent. And always have neoplasia on your list. Always, always have neoplasia, especially if they're more hungry. Or quite often it can be because they've got something growing somewhere and it's taking all their calories. So, yeah, so just keep that on your list too. To be honest, in any cat that's lost weight, even if there's no other symptoms, generally, especially if they're an older cat, I'll generally run like a what I'd call a full biochem. So, like a Chem 17 or at least a Chem 10. So to check for kidney, glucose, liver, protein levels, etc. And then I'd always run a T4 as well, just to double check they're not hyperthyroid. It's quite useful to run your hematology too alongside it, because if you get elevation in white blood cells, you'll be looking for inflammatory problems or infectious problems, obviously, depending on how elevated your white blood cell count is. But also remember, in a lot of these older cats, we see that anemia of chronic disease. So if you get that sort of mild to moderate non-regenerative anemia in these guys, it's worth thinking, okay, there's obviously something going on that's causing them to have a bit of myeloid suppression. But it's worth keeping an eye on it because obviously that PCV can get a little bit lower than we expect. So keep an eye on that too.
That's a real big cat dog difference too, isn't it? Because the
Mm,
older cat, the older teen cat, anemia, whatever, they're so often in the 20s. For
mm,
me personally, if I get a dog any age, blood count in the 20s, high or low, I
mm,
am on the prowl for cancer. I think that's a
yeah,
much bigger red flag. I'd love to see if someone does a study on that.
yeah.
I can just so many times I've had hematocrit 28 on a dog, cancer somewhere. So yeah, just be really on the lookout for it. Um,
Yeah.
Go on.
Yeah, I was just going to say, I think it is so true, isn't it? We seem to tolerate much lower levels, a much lower hematocrit in cats that are older because we assume it's this anemia of chronic disease. And especially with kidneys, you get your reduced EPO, etc. So I think tend to tolerate it a bit better. But in dogs, yeah, definitely, it gets my back up a bit more. I'm like, where is that blood going? So,
And I think this is where the difficulty lies as vets, because when we talk to the client's coming at it from the perspective, regardless of their funds, old cat, they don't want to mess about with their cat. They don't really want to get involved in doing too much treatment because they perceive it as old
mm,
and on its last legs. And so therefore they don't really want to do very much. And I think this is where we have to have a really good chat with them about how much are they going to test? What tests are we going to do? What suits them? And I think there's a bit of an art to this one.
yeah, it's hard, isn't it? I think because in a lot of practices, if you're doing a Chem 17, a hematology, and a T4, you could easily be looking 180 quid, couldn't you? Easy.
Yeah.
So
Yeah.
depending on what machines you use, etc. Now, again, like you can cut out the hematology, or you could do a manual PCV instead, which is going to make it cheaper. You could do like a prep profile instead, which is going to give you the majority of what you need to know, like an NSAID clip type thing, and plus the T4, which is going to make it cheaper. So yeah, it's a discussion with clients, but I would say test for the things that are highest on your list, and then the rest is great. But just warn the owners, obviously, if you're doing a smaller panel, you are more likely to miss other things that you might otherwise pick up. So it's just having that conversation. I guess that brings as well to in these hyperthyroid cats, obviously blood test is going to be how we generally diagnose it. But another really important thing to remember that isn't that expensive is check their blood pressure, because a hell of a lot of these cats are commonly hypertensive, and a lot of them have concurrent problems as well. They might have cardiac disease alongside the hyperthyroidism. They might also have chronic kidney disease and hypertension. So checking their blood pressure, cheap, easy, worth doing. Remember white coat syndrome in cats. Obviously, it might be, if it's a little bit elevated, then I'd be like, it's probably fine. If you're hitting systolic of 220, that's hypertensive. So I'd be thinking, okay, this definitely has a hypertension problem too. And the only other thing I'd say is that I've had quite a lot of hyperthyroid cats that have like a gallop sound when you listen to them. And a gallop sound or an arrhythmia in a cat would make me much more suspicious of underlying cardiac disease. A murmur, I'm a bit like, might be something, might be nothing in a cat, but an arrhythmia makes me more nervous about cardiac disease. So I would generally offer these patients, or the clients for the patient, I'd offer them at least a pro-BNP or a quick echo from just to double check what their LAAO looks like, because you'd be surprised how many of them have underlying cardiac disease as well.
And I think as soon as you get that pro bowel, because I'm obsessed by the bowel, then I will often do the bowel and, well, obviously kidneys, but the heart. I just always, it's such a nice thing if your boss can agree you're priced to include
Mm,
that left atrial measurement as well, because sometimes these patients, if they are entropathic, they're going to go on to prednisolone. And then it's quite nice
mm,
to know, is there a heart issue going on? Because I
yeah,
think, did we cover this in an earlier episode? But 1 in 8 cats over 12 or something have got heart disease. It's so common. So you could
yeah,
argue that screening isn't a bad idea, especially if you've got a
yeah,
murmur or
absolutely. Yeah.
gallop or anything like that.
Yeah,
Yeah,
and
cool. That's good. Yeah.
there are actually a few. I think there's some referral centres, or at least some practices that are pushing for any sort of procedures that they do in older cats. They do recommend like a pre-anaesthetic echo, because the thing is cat heart disease is so difficult to pick up. So sometimes you can be anaesthetising an older cat for a dental, and it's basically in congestive heart failure, and it's not really told you. So it's definitely worth checking these guys if they're keen to do workup, especially if you've got some sort of arrhythmia or a gallop sound. It's 100% worth checking. So yeah, worth remembering.
Yeah. And then we kind of haven't quite touched on this, but I think we all run a total T4, don't we, as our screening
Mm.
test. It's worth just reminding ourselves the difference between free T4 and total T4. Because I think we all know that, or do we all know that if you've got a high normal T4, you've got the option to run a free T4 by equilibrium dialysis, and that might be more sensitive and pick up on an early hyperthyroid.
To put it into simple context, usually the bound T4, the total T4 is what we're normally checking in-house, isn't it? So they're normally the slides that
Yeah.
you run on your machines in-house, whereas your free T4 is generally what you'd send off for. So if in doubt, then, if you're not sure based on your in-house result what's going on, send off for a T4 in an external lab, because usually that will be a free T4.
Yeah, and just so people know that the free T4 is freely running around in the plasma,
Mm,
and the total T4 includes is 99% of the T4 is actually just bound to protein.
mm.
But then when they have illness and things, it can change the ratio, and then it can mess about with your free T4 level. So sometimes the free T4 is misleading in that it will go up with illness as well, because there's now more T4 hanging around. So that's why we don't. It's not like free T4 is better than total T4. It's just it's good at picking up those early cases. But in illness, I think it can be misleading and
Yeah.
can go up inappropriately.
So usually we're always hoping when we try and diagnose a hyperthyroid cat is that you're hoping that your T4 that you run in house is going to be super high, and you're like, bingo, easy. It's like, I don't know, I can't remember what top end of normal is, it like 45?
60.
And yeah, something. And if it's like, I don't know, 90, then you're like, great, it's definitely hypothyroid, fine. What happens if you get those borderline test results? If they're like high normal and they're screaming hypothyroid at you in terms of their symptoms, and you can't find anything else wrong with them, then what do you do then?
Yeah, it's the ones that are high 40s and low 50s, I think, because I think they're definitely not right. I think every normal cat is going to be, I don't know, 20, 10, 15, something like this
Mm.
that I test. And if it's 45, that's in the normal range on the lab, but it's definitely heading towards being an overactive thyroid at some point, I think. I think I look at the owner, because usually this is the problem with these cats, is that you're almost pulling the owner with you on these cases. And that can get awkward, especially when you get a grey area result. And I don't want to kind of feel like keep testing them and get another grey area, and then I'm starting to lose my client's motivation. So depending on how my client is and how bad the weight loss is, I might try and push the next blood test 2 to 3 months down the line. I don't often do a free T4, actually. Maybe I should. So as long as the cat's reasonably well and the owner's not too feeling urgent or worried, and then I would just usually give them some kind of, not placebo, but placebo-like thing, extra food, favorite treat, more poultry diet, supplement or something, and then say, well, let's see you in 2, 3 months. And if the weight's gone down again, then we'll retest them for that thyroid and just see if it's high. Does that fit with your way of doing
Yeah,
things?
sounds good. And I tell you what would actually be really useful here, which has just sprung back to mind. Do you remember ages ago, in a really early pod, we were talking about that cancer blood testing thing, and
Yeah.
we were like, when would you use that? Like, because it's going to give you an idea that there's cancer, but you have no idea where it is or what type of cancer it is. But actually, maybe these would be the really good cases when you're like, he's losing weight, you've done all the blood tests, otherwise you can't really work out what's going on. You've done a basic scan, you're like, can't see an obvious lump. The intestine's not obviously really, really thickened. Maybe these are the ones that you're doing that cancer marker blood test to be like, does it have a tumor somewhere?
This is
Maybe.
The new Q test you're
Yeah,
talking about,
yeah.
yeah. And I think they're working on, I don't know, either a study that shows how it can be used to identify the enteric lymphoma cases. So I
That
think
would be good.
that might, I did read something that might be coming soon. So, and
Yeah.
that would be a real game changer actually, because
Yeah.
I
I
think
can't
there's so
remember
many of
though
those.
whether when we were speaking about it before, I don't know whether that one was specifically canine. I can't remember
Yeah,
whether it was feline. Yeah.
I'm glad
Which
you
should
said that because I was thinking it was
yeah.
canine.
But it would be really cool for these cases because, like you say, it's really difficult to keep owners on side. When you've done blood tests, you've done a basic scan, you can't find anything and they're still losing weight. And the owner's like, what the hell is going on? And you're going, oh, do you want to go for a CT? And they're like, no, thank you. I don't want to spend 1,500 quid to find nothing.
But
So
I'm not in
actually,
that boat. Yeah, because 'cause I'll start them on steroids. That because
yeah,
I'm old of it. I don't know. No, because I'm obsessed with enteropathy, and I know that a
yeah,
lot of them aren't gonna have ultrasonic graphic changes of bowel thickening.
mm,
I know some of them are gonna have a normal B12 and folate, and I'd have already taught them through it, and if the other tests are coming back normal, and usually
mm,
these cats are what, I don't know, 16, 17, 18 plus, I think I'll say, "Look, the cat's 2.2 kilos. Let's try some steroids because it's such a
mm,
disease now,
yeah.
rightly or wrongly. But by that point, at least I've got my bloods, I've got my kidney status, I've got, you
Yeah,
know,
true. But
you
then I
know,
guess if you go down that route and you haven't done this cancer blood marker or whatever it is,
uh,
then you can't say, okay, are my preds helping because it's got intestinal lymphoma or are they helping because it's got chronic enteropathy? But then does it really
yeah,
matter?
but at that age group, it doesn't. And I think
Yeah.
that's something that's so important for the older cats. It's a whole different ball game, isn't it?
Okay, so we've got our positive T4 result, um, and we're still looking at the rest of our bloods, and we're thinking, okay, is it definitely just thyroid disease that's going on, or is there something more going on? And I guess the twist that's worth remembering is that a lot of older cats who can be struggling with hyperthyroidism can also have concurrent chronic kidney disease. Now, the tricky thing is with this is that hyperthyroidism will increase the GFR, which can basically mask or hide azotemia on your bloods. So it sort of doesn't show you initially that they do have chronic kidney disease. So generally, it's recommended in these guys to, if you diagnose hypothyroidism and you start treating, to then recheck bloods a few weeks or month or however long you want to take later to recheck for that azotemia because there are a lot of cats that will then have that CKD unmasked and become obviously much more easy to see. Now, the difficulty in these cases is, are they just coincidentally a part of the same cat? So do you have hypothyroidism and chronic kidney disease that's completely separate and it's just one has happened and the other one has happened and it's a coincidence? Is there a causal link between one? Have we developed hypothyroidism and it's led to chronic kidney disease? It's always going to be a bit tricky to say. But I think the main thing to know is that if they do have both, it might not be immediately obvious from the first blood test because that hyperthyroidism, the high T4, is likely to be masking your azotemia.
Yeah, and whatever your creatinine is, or SDMA, or whatever you like to use, it's going to just go up a
Mm,
little bit once you've controlled your thyroid disease. And that's not because you've made your kidneys worse. It's just you haven't got that actually quite damaging ultrafiltration going on in the kidneys that's kind of actually making the kidneys do a better job of getting rid of creatinine, but it's harming the kidneys at the same
mm,
time. So you're going to see that little pop up a little bit more. So if there's no kidney disease, it might be mild. Once you've controlled their thyroid, if there's mild kidney disease, it might be a bit higher. But the point is, from the owner's point of view, it's still better to control the thyroid. You're going to have better long term health of kidneys by getting the thyroid in the right place.
The one thing that I would say as well is that because you can unmask this chronic kidney disease. Now, to us, that makes a lot of sense, right? We can explain it. But if you don't give owners a heads up that that might happen, they will think that you've given their cat chronic kidney disease because you've given this medication, because you've not warned them. So what I would say is that I would say the kidneys look fine, but we need to keep an eye on them after we've started this medication because sometimes it can unmask that chronic kidney disease. So try and make sure that you mention that first, because otherwise you might get a set of owners that think that you've given their cat chronic kidney disease because you've started them on thyroid meds. So it's worth sort of letting them know that that might happen.
Okay. Are we going to get into the treatment
Yeah, I think
now?
so. I mean, there's so many different things to consider. I think most of us just use meds, don't we? But maybe we start with the most common. So I think a lot of us are just treating these in practice with medications, aren't they? Methimazole, thiamazole, carbimazole. So these are your sort of oral liquid or tablet formulations that you can get. And you can get those transdermal gels as well, the ones that you put on the ear. But to be honest, I've never really got on with them. Do you use them much, Brendan? I just feel like I don't really get on with them that well.
Yeah, I've used them, but yeah, I agree with you. The thing is, as soon as the liquid versions
Mm.
came out, and I feel like it says on some of the instructions you're not meant to put that with food,
Yeah, I
but
think it goes directly into the
I
mouth, doesn't it?
yeah, though. Oh no, I don't need to be careful how I say this because these are harsh drugs, aren't they? And you don't want any contact with
Mm,
humans and all of this stuff. So there's some issues there. But I think a lot of cat owners do end up mixing it with a little bit of a treat,
yeah,
don't you
yeah.
find?
I think
Or
it's one of those things where I'm always worried about the transdermal gels because I think if people forget to wear gloves, then we're technically giving something to people that could make them hypothyroid, probably. I don't know how it would work in people, but obviously that's a risk. So that makes me a bit nervous. I think it irritates their ears as well. Like I've had quite a lot of cats that I've seen that have got like quite
yeah.
unhappy ears after using it for quite a long time, or they get really head shy. It's just not very nice. Whereas I think the oral medications are a lot easier, but I think the liquids in particular, I know one particular brand especially will say it needs to go directly into the mouth. And I think that's more about efficacy. I think they've done studies that show that it works better, apparently, if you give it directly into the mouth rather than into the food. Or whether they just say that because they think that more of it's going to be taken up rather than left in the bowl. I don't know. But yeah, that's something to think about. But I mean, generally they work pretty damn well, don't they? And most cats get on with them quite well. And the nice thing is because you've got the option to either do liquid or tablets or gel, hopefully between any of the medications, you'd have something that can fit for that particular type of cat and the particular owner. So,
Yeah, these drugs are embryotoxic or teratogenic, aren't they? That's the other thing. So I think that's the big issue because I know when we used to say crush the tablets, we were kind of like, you got to be really careful you're not crushing the tablet on your chopping board and then chopping up your salad, whatever. People do it. I bet you people do
mm,
it. I don't know. So I think that might be one of the things they're worried about as
yeah.
well. Yeah, but I mean, overall, it feels like people get on well with these drugs and they do get them in and they do use them.
Yeah.
What to do all these drugs actually do. It interferes with the production of T4. And T4 is the pro hormone. So once you interfere with T4, you interfere with T3. But the important thing is it's not damaging the thyroid gland. It's not shrinking the underlying
Yeah,
pathology,
yeah, exactly.
I
And I
suppose.
think the sort of pros with these medications is that they're reasonably cheap, like people can get hold of them fairly cheaply. You can stop them when you need to, so they're reversible. So if you find that they're not working well for a patient or they're getting side effects, you can stop them. They're quite good for stabilizing patients before considering other therapies. They're fairly easy to give. Most cats tolerate it well, and it sort of gives you some time to give the medication and then recheck their bloods to make sure that there's nothing else going on. So for example, before considering any longer term treatment, you might want to get them on meds and then say, okay, are we going to unmask CKD? Like, how healthy is this cat in general? And sometimes you don't know that until after you've started medication. So that's what's quite nice about them. I guess if you were going to talk about cons, what would you say is sort of the downsides to regular meds for these guys?
They're usually well tolerated. I don't know. There's that odd cat that will get the facial pruritus. I always find it's facial. And I don't know. I feel like it's a little bit delayed, maybe 3 weeks after you start treatment. And you can't miss it. I used to warn owners it might happen, and I'm not sure I do all the time now because I think when it happens, it's quite marked and it's pretty obvious.
Mm,
Blood dyscrasias are common though. I think on the hematology, some white blood cell doing something a bit weird is I definitely feel like I see that now and then,
mm.
but I don't think it's clinically
Mm.
relevant.
Okay, so that's sort of option one that we have available to us, our medical management. Option two, if we want to look at that, is our dietary management. So we're talking iodine restricted diets. Now, I don't think I've ever done this. Have you ever done this in practice? Have you ever said, let's not give it meds and stick it on
Yes.
food?
Yeah. When it first came out, I probably used to chat about it, and then I've probably had 2 clients over the last whatever years do it. And I think you do. I've definitely had the odd client that feels very happy
Oh,
about it.
really?
I feel like I've heard some more negativity about it more recently. I don't know. I mean, is it even still available? It's so
So I had a
infrequent
look
now.
because I didn't actually know this was a thing. So that's probably me being really stupid. But like I've never heard of it or heard anyone use
Yeah.
it before. It's still commercially available. You can get it through sort of your big veterinary prescription diets. But there's just so many elements to it. It has to be an indoor cat because if they eat anything outside, it completely negates it. They can't have any treats, no other food, not getting in touch with any other cat food or scraps or whatever. They can't eat anything else. And I just think it's like a diet trial. People never bloody do it right, do they? Like they're always like, yeah, yeah, we'll do that. And then it's not worked. And you're like, well, have you been giving it gravy bones? And they're like, oh, yeah. Like it just that people just don't, it doesn't work a lot of the time, does it? So I think unless you've got the super committed client and a cat that absolutely loves the food, I don't know
Yeah.
how well it's going to work. And how quickly does it work as well? Like I feel like medication is quite fast. Whereas if you're talking food, is it going to take like a few weeks, a few months for it to start really working?
Yeah, I can't remember.
Yeah.
I remember the reps coming over with the lab work. It definitely worked in the lab studies they
Mm.
did. I can't quite recall how quick. Treatment number 3, radioactive
Yeah,
iodine.
I think yeah, I love it if owners are on board and if it's the right kind of cat. I mean, like, you're talking cure rather than a sort of palliative treatment, really, aren't you? But it's not for every
Yeah.
cat and it's not for every client. Like, if you've got an owner who's not particularly well, you're not really going to want to be sending them back a radioactive cat. That's not ideal. If you've got a cat who has other comorbidities, heart disease, chronic kidney disease, neoplasia somewhere, you're not really going to want to be sending them for radioactive iodine. I think it has to be the right cat and the right client. But I mean, there's so many good things about it, aren't they?
Yeah, do you know what? The number one case for me is if the cat's on the younger end of the age spectrum,
Yeah.
10, 11 years old, because you just think, well, you might have 9, 8, 9, 10 years. And also being a bit kind of careful with my money, I feel like it's more value for money, isn't
Yeah,
it?
longer term.
If you're gonna
Yeah,
get another 8, 9
exactly.
years. Yeah. And you could make a case for the stressed cat. It's a better treatment because it's all done in one hit,
Mm,
mostly, rather than the regular checkups, regular blood
yeah,
tests, and
true.
tend to, other than the younger cat, i.e., the 10, 11, 12-year-old cat that looks really well. The other time I wheel it out is if the thyroid dose keeps going
Mm,
up, like so every year or so. Oh, especially as I say, the goiters, the thyroid glands are quite big and chunky, and they're not just not stable. It's not fun for owners. Then you're having to constantly up the
yeah.
dose. There, obviously, that's another one
Exactly.
to
I think
consider. I
if
think.
people are happy for it, then it's it is expensive. It does mean referral. It's a lot of cooperation from the owners, and they have to be on board with it. But I think it can work amazingly well. The nice thing is that you target all the thyroid tissue, so even if you've got that funny ectopic thyroid tissue, it will still do the trick. And they say that there's about a 95 to 99% cure rate. So you can give that figure to owners and say, the majority of the time it works incredibly well and it does cure them, but there's always a possibility that it doesn't. And it is. I didn't realize this actually, but it is only a single injection of radioactive iodine. I thought it was multiple, but it is literally one. And then they just have to stay there because they're radioactive. But they say a small percentage of cats can become hypothyroid. So you have to be a little bit careful with that. And they need supplementation afterwards if that's the case. But they say the majority of cats show a normal thyroid level within weeks, which is amazing. So it can happen really, really quickly. So that's our third option and possibly the most ideal if it fits for the cat and for the client. But let's talk about the bit of the controversial fourth option, which used to be done all the time, surgery, so thyroidectomies. So have you ever done one? You have?
Yeah,
Yeah.
I've done a
Yeah.
few. I think we used to do them more too because we used to have the tablets, which some cats it would be hard to
Mm.
give. So then it seemed like a good
Yeah, I
option.
think the thing for me is the risk of you risk the hypoparathyroidism as well because the thyroid glands are obviously connected. So you can talk about
Yeah.
hypocalcemia and stuff as side effects afterwards. You've got to anaesthetize an older cat, which a lot of people probably aren't going to be on board with. So I think you'd have to get clients on side. But I think the big thing that worries me about it is the ectopic thyroid tissue. Like you could do everything perfect with the surgery, get the whole glands out and think you've done a really great job. You don't get any side effects with the parathyroids, but then there's still hyperthyroid post-surgery because you've got ectopic tissue somewhere that you didn't know about. So I think that's the thing that makes me a bit nervous about it. It's not something that I'd be recommending to everyone, put it that way.
Do you think owners are a bit disproportionately worried about their cat having the radioactive iodine?
Mm,
Because you say, oh, they have to be over at the hospital for a week or
yeah.
whatever, and they're like, oh my god. But it's like it's not that bad, is it? I mean, for the sake of a lifetime cure, I think it's fair
Yeah,
trade.
it's I don't know.
Yeah, if I was a cat, I'd be
Yeah.
okay with it.
Okay, so we talked about our 4 different ways that you could treat hyperthyroid cats, but now we need to talk about monitoring how when we start treatment, how we're gonna monitor these patients. Now, it's gonna be very dependent on the type of treatment that you've chosen. So obviously, medical treatment versus radioactive iodine versus thyroidectomy is gonna be very different in terms of monitoring. But I guess generally we're talking about checking your T4 in-house, your renal parameters, what their clinical signs are doing.
I normally see them 2 weeks down the
Mhm.
line. I'm looking for weight gain because I know obviously if I've got weight gain, I've probably got the right dose. And then I might do a blood test somewhere between 2 to 4 weeks from the start of
Yeah.
treatment. And I'll do my hematology to look for blood dyscrasias, I guess. Obviously, I want my kidney parameters and I want my thyroid. Yeah, and then my post-op after that, once I've got my thyroid where I want it, I think as long as the weight's going up and everything's going I say, yeah, bottom line, if the weight's going up, heart rate's kind of where it roughly should be. I'm not rushing to do more T4s in that context, but I think you might need to write on your notes that the data sheet says every 3 months for blood tests.
Yeah, I think it is every 3 months, but I guess it depends on the medication you're using. So I had a little checkup before we were recording today just to see what the data sheet
Good.
said. And I mean, if you wanted to go by the book, it says that you should be doing a hematology, a biochemistry, and a serum total T4 before initiating treatment and after 3 weeks, 6 weeks, 10 weeks, 20 weeks, and then every 3 months after that. Now, again, it's contextualized care, isn't it? If you've got a cat that is incredibly stressed every time it comes to the vets, ultimately, if it's gaining weight, it's no longer slightly PUPD, it's no longer yowling like crazy and trying to inhale every single bit of food that it has. If it's settled and it's comfortable and it's happy, like okay, fine. If it starts to get more unwell, then yeah, blood test it. And I mean, I'm not saying that we should never be blood testing these cats, but I think we can be less strict than what the data sheet might be saying, as long as you, again, you write in your notes, we've made the decision not to blood test as regularly for these reasons. That's fine. You're allowed that contextualized care. But if you wanted to go by the book and for those really committed owners and the cats that are easier to blood sample, then yeah, absolutely, regular testing would be fab. So
Yeah, and I'm going to do a little diversion again because you mentioned about the yowling or the nighttime
yeah.
yowling. Just for people who maybe have not been in practice very long, I find that when you have a hyperthyroid with yowling, typically nighttime yowling, they will get better, won't they, when you treat the
Mm,
thyroid? But I find they still yowl a little bit.
mm.
So I tend to say to the owner, yeah, you might find this will get better, but it might not stop. I think an element of the yowling is, well, I perceive it as senility,
Maybe.
but or confusion, or an element of
Yeah.
that. But
Also worth thinking about as well, if you haven't checked your blood pressure by this point, or I mean the cat's blood pressure, not yours. So if you haven't checked blood pressure, if it's still doing those kind of behaviors, it still might be hypertensive and you've just not known. So that is worth checking those sorts of things as well, because if vision is changing, then it might change behavior, which then might change vocalization, etc. So there's different things that can be going on too. And like you say, feline cognitive decline, etc., is always in the mix somewhere because generally they are older cats. So it can be other things. Wrapping up hyperthyroidism in cats, I think it's worth just mentioning it is incredibly rare, but I know we always think hyperthyroidism is cats, hypothyroidism is dogs. There are exceptions to the rules, and cats can still get hypothyroidism. So, would not necessarily 100% always rule it out, but it is rare. So, it is not a common thing. And to be honest, most of the time that you see it is because you've swung them too much the other way when you've been treating them for hyperthyroidism. So, it's worth keeping an eye out for. And if they fit hypothyroid symptoms, it's worth checking, but it's not something that I would have on the top of my list by any means. So,
it doesn't present like, I don't think it presents like
no.
dogs. I think renal disease
Yeah.
and post radioactive iodine treatment, I think,
Yeah.
but it's off the top of my head. Okay, so are we ready? Are we ready for
I think we
canines?
are. So we've done cats. I feel like we've done them. But what about our lovely doggos? So let's move on to hypothyroidism. So what actually is hypothyroidism in dogs?
It it's typically immune mediated destruction of the thyroid
Hmm.
gland. which is relevant to diagnosis because we've got a lot of clever ways we can get there. It's a lymphocytic thyroiditis, inflammation caused by lymphocytes. I think eventually you get atrophy. Maybe sometimes you just get atrophy. Mostly middle-aged, older dogs, medium to large breed dogs, mostly,
Yeah.
I think is fair to
Yeah, I
say.
think so.
Yeah.
Yeah, I think it's that lymphocytic thyroiditis. I think they say that it's either that or this idiopathic atrophy, which we don't really know why it's happened. Those two together make up about 95% of the cases you're going to see. But there are more rare causes that we can see, like thyroid tumors, genital hypothyroidism, so birth defects, or damage from radiation therapy. But to be honest, they're much less common. So most of the time, it's going to be to do with the actual thyroid gland itself. And like you say, immune mediated destruction or atrophy. So, and when we were talking about T4 and T3 earlier, how does that fit here?
God knows. Well, it's less production of T4, therefore less T3,
Yeah,
presumably. Is
exactly.
that
Yeah.
where you
Yeah. So
look,
I think
yeah?
it's basically reduced T4, which means that you get reduced T3, so slowed metabolism, and basically just everything slows down and you get weight gain because the metabolic rate is slower. It's basically how I think of it. So when we talk about that in terms of a clinical scenario and sort of the classic signalment that we're going to get, you've already said you're possibly larger breed dogs that are maybe middle aged, maybe like 4 to 10 years, depending on breed. What are we generally going to be seeing clinical sign wise?
I was going to say it's just like it's cousin disease. Can we call it cousin disease Cushing's? I don't know. It's just that both those diseases are come on gradual over months. They kind of sneak up on you and they both involve weight
Mm,
gain, which is kind of unusual for a disease,
mm,
isn't it? So that's why I kind of say that. But obviously with Cushing's, you've got lots of thirst, therefore drinking a lot, weeing at night, weeing in the house, urinary problems. So that's the Cushing side. But the thyroid, low thyroid, you don't have any of the increased thirst. You don't have that side of things. So it's coming on gradual. It's weight gain. It's owners that are trying to diet their dog and they're not succeeding. And then eventually, if left for quite a few months, which is common, you get the dermatological
mm.
changes, which is they come in with like a patchy alopecia on their flanks or on the tail, rat tail on the
Yeah.
tail. And sometimes in the exam, you can just pull the hair out and make it even more bald. I don't know if you've done that,
Yeah. I mean,
but I've
they
done that a
talk
few
about that like
times.
tragic expression that they get as well, like the myxedema in their face,
Oh, yeah.
and potentially bradycardia. Sometimes they say infertility, but I mean, how are you going to know how many people are actively trying to breed these dogs because they're middle to older age? So I don't know. And they
Yeah.
say rarely
Yeah.
neurological signs. So in theory, it should be on your list for seizures. Um, and sort of neuroscience in your middle aged to older dogs. To be completely honest, though, when I was in vet school, it got taught as if we were going to see these cases all the time. I honestly don't think I've ever diagnosed one in practice. I look for it, but I don't think I've ever diagnosed one. I've seen some that are on meds, but I don't think I've ever diagnosed one because every time I look, it comes back negative. So I just don't think it's anywhere near as common as we thought it was or as it is portrayed when you're in vet school. So I don't know about you. Have you seen many of them that you've actually started on meds?
I've had a few. I must say they're the most wonderful cases to
Mm,
have. Yeah, I probably get a case every 3 or 4 years, so yeah, they're not that
no.
common, but they're the most fun
Yeah.
cases because over a month or 3, they just go
Yeah.
perfect, and they're easy to manage. It's very predictable and pleasant.
Yeah.
There's more caveats to with diagnosis with sighthounds, isn't there? Sighthounds have low T4 when you measure it, so TSH usually normal, occasionally slightly increased, but not consistently.
So it's basically like you might get a slightly low T4, but you're not going to have a really severely elevated TSH like you would do in your normal hypothyroid cases because it's a normal T4 for them, even though it looks slightly low. So I guess that's the way to look at it, isn't it? So basically, we're now talking about diagnosing hypothyroidism in dogs. And like in cats, it's a little bit easier. Generally, you run your in-house T4, so your total T4, and you get an answer the majority of the time. If it's high, they're hypothyroid, fine. Yes, you have those ones that are borderline and you need to do more testing, but fine. In dogs, it's a little bit more tricky because not only do you need that T4, but you need it in combination with your thyroid stimulating hormone. So, to prove that a dog is hypothyroid, they need to have both a low T4 and an elevated TSH because that proves that the body is trying to say, you need more thyroid hormone, please make it. And the thyroid gland is going, no, I'm going to completely ignore you. And it's still low. So that you need those two together to be able to prove it. Now, the other thing that's worth bearing in mind here is that low T4 on its own does not equal hypothyroidism for another reason, because we can sometimes see euthyroid sick syndrome, which makes things a bit more complicated. So basically, in any illness from skin disease to infections to other systemic diseases, you can get a suppression of T4. So a low T4 on its own does not mean hypothyroidism. It technically means that, yes, there is a slightly lower thyroxine level in the blood, but it could be for various reasons. So you need that TSH to be able to confirm it. That's what we're normally looking for in terms of diagnosis, isn't it?
If you get the classic one,
Yeah.
yeah. But if you've got a really high clinical suspicion, the TSH is normal, and that I think that can be 1 in 3, 1 in
Mm.
4, then yeah, then you've got some thinking to do. When I run the test now, if I'm really suspicious, I will really be tempted to do the full like panel, which has got the thyroid antibodies on as well. So I'll get the whole thing. So because the thyroid antibodies can make the T4 look artificially
Okay.
higher as well, and also if you get the thyroid antibodies, you know the disease is coming. So it's kind of increasing your index of suspicion. So yeah, so I quite like TSH4 and thyroid antibodies, just all in one hit and try and really nail it as quick as I
Yeah.
can. But I'm really keen to have some dermatological changes before I start rushing into
Mm.
testing. Because once you start treatment, you can't backtrack it, can
No.
you? It suppresses the natural T4 production, and you're kind of on this kind of slippery slope of treatment.
Yeah, I think ultimately with these cases, if you get a lab result that you're not expecting, call the lab and have a chat to them, speak to the clinical pathologist, or say, I don't know, if you're partnered with Zoetis or whoever, then they have internal medics and people that you can speak to for free and chat to them and say, okay, I've got this result. These are my clinical signs. What would you suggest I do next? And it just gives you an outside perspective. So they're not always straightforward cases in terms of diagnosis. So
Yeah, we had one about 2 months ago. It wasn't mine. One of the other vets walked it through and she was like, classic thyroid, low thyroid, it had skin and ear infections, alopecia. It had hyperpigmentation on the alopecia
mm,
patches and maybe beyond as well, actually. Weight, obviously, weight gain. We were all like, yeah, that could be it. So they're the kind of, that's what you're looking
yeah,
for
exactly.
anyway. And be really positive about them because they are nice cases to
Yeah,
treat.
exactly. And then when we're talking about actual treatment, so it's far simpler than in cats, isn't it? So it's
Isn't it?
levothyroxine, which is what we're using. So there's loads of different brand names for it, but levothyroxine is the drug name. I think that it's suggested that you can do it twice a day or once a day, but I think actually, because I had a look at one of the common data sheets on it before the pod, and it does say to start off at once daily dosing and then go from there. So I do think that a lot of people in the UK are now doing once daily dosing, but I don't know what the formulary says about it. It probably says once or twice.
Yeah. Oh, I was trying to find it.
Have
Here
you
it
got it?
is. I've got it. It is given with food once or divided twice a day. Yeah.
Yeah. So, but then it's like the formulary said initially that you could give gabapentin 10 to 60 mg per kg. So, like, don't always
Yeah.
don't
Yeah.
always trust everything that the formulary
Yeah.
says.
Good.
In terms of blood testing, again, I had a little check of one of the common data sheets, and it says in terms of monitoring, you've got two ways that you can do it. You can either take blood tests at their trough levels just before treatment would be due. So, say they gave their pill at 9 a.m. every day. If you got them in for a blood test at 8 to half 8, then that's going to be your perfect trough level, or peak values. So, about 3 hours after dosing, then you measure your T4 at that point. In really well dosed dogs, their peak plasma concentration should be in the high normal range. So, like in our hyperthyroid cats, we want low normal. In dogs, we want high normal of the range. And your trough values should be about, well, this says about 19. So, probably what, low to mid range. But I think that it's basically saying that if you're happy and clinical signs are good, you don't necessarily need to be doing TSH every time too. You can use just your normal T4 levels to check it, which makes things way simpler and way cheaper. And then it just says if you need to do dose adjustments, to do it slowly in small increments, and adjust as needed until it's within the reference range.
Yeah, and choosing between whether you do a peak one at 3 to 4 hours or whether you do a trough one at just pre-tablet is dependent on where you think you are with that particular patient. Sometimes the context, you've got, beautiful fur coat, slim dog, or whatever. You're going to think, well, my trough has got to be okay. I'm more interested where my peak is because if my peak's too high, I might
Mm,
bring down. Similarly, if you've got, maybe slight weight gain and, the coat's not 100%,
yeah,
maybe you're going to be more interested in your
yeah,
trough. So I think that's really important because sometimes these clients will phone up reception, say, when do I do my blood test? Reception will then ask a nurse, when do you do the blood test for the T4
Mm,
monitoring, and then you'll just get this empirical
mm.
answer. But I think there is a clinical case to be made from the
Yeah,
clinician to talk through the owner which one's most
yeah,
appropriate.
yeah, yeah.
I was going to say, they always tell you to check in any neuro condition, to check your like seizuring or any neuropathy, to check your T4. And I must say, I got a bit bored of checking because it was so often normal, but I know I suppose I should. And then, and megasophagus. Is that
Mm.
another one? I think
I think
megasophagus is one
so.
where you meant to check your
Yeah,
T4.
but I always
Yeah.
think in those
So,
cases with your euthyroid 6 syndrome, like if something's seizuring, it's not systemically well, so
huh?
isn't it gonna be slightly low anyway? And then if it is slightly low, is it because of what's going on in the body or is it the cause of what's going on? Like, how do you know? Are you supposed to be doing T4 and TSH in
Ugh,
those guys? So that's the tricky thing, isn't it?
probably.
And I'd say that, you're not gonna be able to fix the thyroid problem while it's seizuring, so I'd argue, well, treat what you can see in front of you, get it more stable, and then be checking because then you're more likely to have a correct answer
When
anyway.
it's well.
Yeah, exactly. It's
Well,
kind of like if you've got a diabetic patient and you think it's Cushing, you shouldn't do an ACTH stim when it's still really unstable as a diabetic because you're gonna get an aberrant results. It's I feel like it's probably kinda similar.
should we just quickly do, because it's quite interesting to contrast the two. Cushing's
Mhm,
dogs and low thyroid dogs are both ones that are well. They're well
mm,
dogs. They're both gaining weight. They've both got hair loss, symmetrical
mhm.
hair loss, haven't they?
I think it's more the sort of
Yeah.
lethargy and the absence of the typical Cushing symptoms that would make me think it's more likely thyroid because you get some of the same symptoms, but without your severe polyphagia, PEPD, etc.
The Cushings are lethargic, slowing down as
Yeah.
well, but it's the weeing at
Mm,
night, messing in the house, all of these things. But also on the bloods, ALKP is nearly always going to be really elevated in the
mm,
Cushings because of the steroid. Obviously, induces the
mhm.
ALKP, whereas the thyroid not going to have that. So there's another point of difference, isn't there? I
Yeah.
suppose they're not normally hard to distinguish, but I think when you're a student and before you see many clinical cases, it's hard to get them straight in your
Yeah.
head, the difference between the two.
And I guess that the only one last thing
There
that's
you
sort of
are.
worth covering is any side effects of medications. Again, the list is like as long as your arm of all the different things that you can see. And normally they say that it's the side effects that you'd get would be associated with if you were giving too much. So if you think that they're getting more hyperthyroid, so weight loss without lots of appetite, hyperactivity, excitability, panting, tachycardia, PUPD, all the things that you'd notice if they were swinging the other way. So basically, if you think they've turned hyperthyroid because of their symptoms, it's probably a side effect of the medication and you're giving too much.
And it is as classic
Yeah.
as that because I've had cases, not mine, I'll add, but yeah, that is it. Vomiting, diarrhea, get GI signs, they're polyphagic, they're losing weight, and it's kind of like, oh
Yeah.
yeah, oops, someone's might have got this dose a bit too high.
Exactly, exactly. So,
Yeah.
but I think we're at roundup time. So we've covered a lot of ground again today from presentation to diagnosis, workup, and treatment options for both hyper and hypothyroidism in our dogs and cats. Things to watch out for and how to manage these cases generally.
We hope that's broken things down for you a little bit and made the cases a bit easier to handle and manage in
Yeah,
practice.
absolutely. And as always, please do get in contact with any comments or suggestions you have for us or topics you'd like us to cover next. Remember, you can contact us via our blog on our website, on WhatsApp, or via our social channels.
We look forward to seeing you next Sunday for our next 2-week takedown episode. We'll be covering nurturing controversies. It's a biggie. And we've got ophthalmology and general practice and much, much more. So until then, it's bye from me.
Take care.
This podcast is intended for licensed veterinary professionals and is provided for educational and discussion purposes only. Whilst it's publicly accessible, it is not intended as advice for pet owners.
The views shared are based on our own clinical experience and interpretation and do not replace individual clinical judgment. We accept no responsibility for decisions made based on this content, and all cases should be assessed on an individual basis.
Any references to medications, treatments, or products are made for educational discussion only and are not intended to promote or advertise veterinary medicines to the general public. Veterinary medicine should only be used under the direction of a prescribing veterinary surgeon and in accordance with UK veterinary medicine regulations.
This podcast may include paid partnerships or sponsorships. These do not influence our clinical opinions, and any sponsored content will be clearly identified.